Preston Smith. I'm the representative of Stryker. Thank you for allowing me to come in today. I appreciate y'all's time. I know you have a busy day. I talked to Steve out in the lobby. He said I have about 15 minutes, so I'll make sure to stay in within that time constraint. First off, I know that y'all don't know me very well. This is one of my first times coming in here. So I want to make this not so much about Stryker and the products that we provide, but why you can entrust me, and why you can trust Stryker's products, and why you can entrust that each and every single one of your patients will have a product that's going to fit them for the longevity of the system. And that in return will have an inverse effect on you and your practice. So first off, before I talk a little bit more about the product in depth, I want to talk about the design innovation and how we got to the point of getting to the triathlon knee. So when we were looking at developing the triathlon knee, we looked at the main components of why are people displeased with a knee replacement. And we found that 1 out of every 5 patients is dissatisfied with the knee replacement. Now that doesn't mean that 1 out of every 5 knee replacement is a failure. It means that 1 out of every 5 patient is a little bit uncomfortable with how their knee replacement is operating within their body. So then we took that a little bit further. We said, okay, why is that? And so then we found that an increased 28% of patients have a higher dissatisfaction when they're performing high demand activities. So that's exactly what the Stryker Triathlon knee replacement is trying to accomplish. It is a product that is for high demand activities, and it is able to have the tibial and femoral rotation that restores the natural kinematics of the knee. And with that, we looked a little bit in depth, and we found that there's 3 main components that we need to take a look at and fix that other knee replacement systems don't have. And one, that's going to be improved motion without sacrificing stability. 2, patient satisfaction, obviously. And 3, increased longevity. So first, you're going to have you have increased mobility without sacrificing stability. And for that, you have the rotary arc, the flared posterior condyles, and the patent anatomic radius, along with so the rotary arc is first. Now, the rotary arc is designed to give an internal and external rotation beyond what else is offered out there on the market. So the internal and external rotation is going to be it's going to offer a more internal and external rotation that is not going to be sacrificing stability at the same time. And so what that's going to do is it's going to allow someone to perform movements beyond just a linear movement forwards and backwards, but more so side to side, internal, external. We found tremendous success with this. The rotary arc is part of why we've had so much success since 2005 when this product came out to market, and it's been installed in millions of places worldwide. The rotary arc and the internal and external rotation is actually become an increasingly popular product for athletes and current athletes and former athletes. And that's in part because of the rotational capability. And in fact, one current golfer, Fred Frank, he was facing the end of his career. When he was facing the end of his career, it was because he was having a lack of joint and knee function. And he didn't want to end his career, and he kept on pushing forward, and he had numerous injuries. And because of those injuries, it was causing an indefinite halt to his career. But then he got the Stryker knee implant. His doctor, Dr. Sanders out of Memphis, said that this is the best product for someone especially for a golfer that needs the pullback on their backswing as their knees rotate backward, and the force that he used to have crushing the ball as he moves forward through his swing. And that's what the internal and external rotation gives to you. And not only was he able to return to golf, but he actually won a major tournament, and he credits that to the Stryker Triathlon knee replacement. Now, how we're able to do this is through our proprietary 4-axle technology that is one of a kind. We're the only one who offers this. And as you can see, the traditional method is going to be a linear, and it's going to be a trough. It's going to be a trough structure. And according to Thomas Jefferson Hospital, the linear flat method is going to have a significant higher rate of failure than the rotary arc. And the rotary arc is going to give you a nice gliding motion, which is exactly why Fred was allowed to have that capability and actually win a major tour. The second one is going to be the patent anatomic radius. As you can see on the diagram here, that no matter if it's 10 degrees of flexion or 110 degrees of flexion, that centered anatomic radius is going to stay the same. It gives you ligament stability, so that when you're either ascending or descending through a staircase, you're going to be feeling comfort. You're going to be having the confidence to go outside, either garden like a mother would, or like a father would. You can take the stairs rather than the elevator. Inversely, that's going to have an effect on his health. And then the third component is going to be the flare posterior condyles, which the flare posterior condyles is going to allow you to have beyond 100, you have 150 degrees of deep flexion. And the flare posterior condyles allows for, as the femoral component rises up, your tibial component naturally rotates inwards. So we allowed for an added 20 degrees of rotation on that tibial component. And that's become vital for people like cyclists, where they have that natural rotation as they're going through a bike, and they can have that rotation, and they can confidently get on a bike and push forward and stay in good health. Inversely, for your surgeons, that's going to have a great return through referrals and a satisfaction rate. And the next thing I want to talk about is the 7-degree flange that we have on the patellofemoral tract. Now, the patellofemoral tract is going to be right here, and that is something that we have had equipped into our knee systems for 30 years. In fact, it has the lowest failure rate out of any knee system on the market for the past 30 years, at 0.3%. Now, that's a pretty remarkable statistic, but I want to focus more on the 7-degree flange. So what the 7-degree flange is going to allow you to do, as a surgeon, when you install the implant is going to be able to have a 7-degree downsizing, so that you don't have to get a perfect fit once you put it in, and that 7-degree angle will naturally come together with the knee. It'll give a nice snug fit with removing the possibility of notching. And that 7 degrees of downsizing is going to add into a little bit of how we're going to be able to accomplish early mobilization. Now, through early mobilization with the 7-degree angle, it is said by Kuiper Meyer in the JBJS that with this, he said he did a study and he inquired 187 different patients that had the triathlon knee system implanted into their body, and through 7 different centers. And the success rate, or the early mobilization, was within 6 weeks, they had 117 degrees of flexion. And that was in part because the flange was able to equip into the body more steadily and more quickly than other products on the market. Now, the next couple of things I'm going to go over are something that's similar to other products on the market. We have a highly cross-linked polyethylene, and just like a lot of other companies and a lot of other products, it's highly cross-linked polyethylene. But with ours, it's the same standard, if not better. In fact, that's been proven. A statistic came out on the JVJS by Dr. Hawthorne, and there were statistics that said at 7 years, when he studied 216 patients, at 7 years, he had a survival rate of 98.7%. And in another study done by Thomas Jefferson Hospital out of Boston, which I mentioned earlier, most polywear failures come in the first 7 years. So if you combine those two together, that says a lot to what our polyethylene, highly cross-linked polyethylene, can do in the longevity of it. And then the final thing I'd like to talk about is the instrumentation. So instrumentation, very similar to other companies and other systems on the market. But with ours, we take a huge effort into our ergonomical design and innovation year after year. At Stryker, we're trying to become the gold standard as far as our instrumentation goes, and hopefully we're going to be accomplishing that very soon. But some of the things that we've done is we have soft grip handles, so for you surgeons, it's going to make for easy transitions, and you're going to be able to grab the handles a lot easier. They're not going to be able to fall out of your hands because those gloves are a little too big, they're not very tight. And then there's also a quick attach and release, which is going to make for good transitions, and it's going to speed up the surgical process potentially a little bit. And speeding up the process, I mean, that could have a huge impact on your day, your month, your year, whether it's getting a surgery in at the end of the day or it's getting home to your family to spend a little bit more time with them. And I mentioned family because that's ultimately what this product represents to me. And I know it sounds cheesy because I'm a representative of Stryker, and this is Stryker's product, and I'm saying family up here. But it does. Frankly, I don't know where I would be without this knee replacement, and that's because of my mother. My mother got this knee replacement into her system about 5 years ago. A little backstory about it. My mom was a professional tennis player. She had to end her career early due to knee issues. But like common athletes, when their career ends, they're not going to be immobile. They're not going to get lazy. They're going to keep that high demand activity and effort that they have had for the past 20 years of their life. So that's what my mom did. For the next 10 years, she continued to play tennis recreationally, run, bike. And that wear and tear continued to build up and continued to build up. And eventually, it caused her to have significant knee problems and had an inverse effect on the rest of her health. Whether her knees would buckle up, give out, she would tear her Achilles tendon just walking from the grocery store, or her knee would give out, she would fall, and she would break her wrist. She was in and out of the hospital for 5 years. And seeing my mom being a professional tennis player, working out all the time, then to be landlocked in a couch or in a hospital 50% of the year for 5 years straight, it was devastating to me. But more importantly, it was devastating to my mom. And then the Stryker triathlon knee replacement came into play. Before this, she had tried many things. Bone spurs, she tried to get the bone spurs removed, she tried to get injections. Nothing really worked. And the reason she didn't want to get a knee replacement is because the knee replacement had a stigma that's an end-all, fail-all. And so if you have a knee replacement, you're pretty much putting an expiration date on yourself because these knee replacements may have an expiration date themselves. My mom didn't want to have an expiration date. So she finally, after enough pain, decided to get this knee replacement. And it has improved my family's life, her life, tremendously. Instead of sitting on that couch, wondering about what dreams she could accomplish with her and my dad, because their dream's always been to travel the world, she's now able to accomplish that goal. Just this morning, I got a picture of my mom hiking up King Arthur's Seat in Scotland. And that's partly because of the anatomical radius and being able to ascend and descend down hills. And then as well, a week ago, I got another picture of her biking around the Roman Colosseum with my father. And that's because of the deepened radius and the flared as well. And that allows her to have a nice steady motion where she can bike 50 miles at a time without having any pain, where her knee can make that rotation, where her tibial format follows the natural femoral component of her knee. Now, that's just a little backstory about how you can entrust me, because I entrusted my own mother. This is a product that I wouldn't recommend if I didn't trust. Now, I know that preservation of life is something that is what you surgeons and nurses give to each and every patient. And for that, I thank you. But what the triathlon knee replacement does is it gives you the stability. It gives you the stability and confidence in your patients, so they not only won't have to just go get a bone spur and be afraid of a knee replacement, they can have the confidence to get that knee replacement and the peace of mind of following through with their dreams and their goals of what they want to do in life. Thanks.